Hello, my name is Izana Azin, and I'm an interventional radiologist at Gundersen Lutheran Medical Center in La Crosse, Wisconsin. I would like to share the story of one of our patients with uterine fibroids and how she was helped by uterine fibroid embolization, or UFE. Our patient is a 43-year-old woman with a 2-year history of severe cramping and heavy bleeding during her periods. In fact, her bleeding was so heavy that she often bled through and around her sanitary pads, soiling her undergarments. Because of this, she was uncomfortable leaving her house or her workplace without knowing the exact location of the closest bathroom. She knew she had uterine fibroids and was interested in learning more about UFE as a treatment option. So, she scheduled an appointment to meet with an interventional radiologist. Prior to meeting with the interventional radiologist, she underwent an MRI scan of her uterus. The MRI scan is important. These are 2 slices through the uterus from her MRI scan. The image on the left shows a uterine fibroid extending into the central cavity of the uterus. This type of fibroid is called a submucosal fibroid. Submucosal fibroids are often the cause of severe menstrual bleeding. The bright white color of this fibroid means that it has a lot of blood flow going through it. She also has other fibroids in the uterus. These additional fibroids may be contributing to her pain. She met with an interventional radiologist in the outpatient clinic to review her medical history, MRI, and undergo a physical examination. At this clinic visit, her interventional radiologist explained the UFE procedure in detail, including the procedure steps, risks, benefits, chance of success, and what to expect after the procedure. They also reviewed alternative treatment options, including surgery. After considering all of her options, she decided that UFE was a good option for treating her fibroids. The rest of the video will show you the major steps performed immediately before, during, and after her uterine fibroid embolization procedure. UFE, or UFE, is a minimally invasive, non-surgical procedure performed by an interventional radiologist. During UFE, the blood vessels feeding the fibroids are blocked with millions of tiny plastic particles. Each particle is smaller than a grain of sand. This starves the fibroids of the nutrients and oxygen they need to grow. As a result, the fibroids stop growing, become smaller, and become softer. Because there is almost no blood flow left to them, the fibroids also stop bleeding. On the day of your UFE procedure, after registering, a staff member will greet you in the interventional radiology waiting room. You will be led to a private area where you will take off your clothes and put on a gown. Your interventional radiologist will explain the procedure to you and any friends or family members with you. You will have the opportunity to have all your questions answered before agreeing to the procedure. An interventional radiology nurse will place an IV in your arm, ask you a few questions, and give you some medications. You will then be wheeled to the procedure room on a bed. After arriving in the procedure room, you will be moved from your bed onto the procedure table. You will see a movable, square-shaped X-ray camera above your body. Sterile drapes will be placed across your belly and legs. 4 other people will be in the procedure room with you. The interventional radiologist and a technologist will be in sterile gowns. A second technologist will also be present to help with the procedure. A nurse will be present throughout the procedure to continuously monitor your vital signs and give you medications. You will be made sleepy, calm, and pain-free. You will not have a breathing tube. You may or may not fall asleep during the procedure. After you have been made comfortable, your interventional radiologist makes a tiny skin nick in the groin. A very thin, hollow tube called a sheath is passed through the skin nick and into a blood vessel in the groin. A spaghetti-like tube called a catheter will then be passed through the sheath into the aorta, a large blood vessel in your abdomen that supplies smaller blood vessels leading to the uterus. We will then inject X-ray contrast dye through the catheter to create a blood vessel roadmap to the uterus. With our roadmap for guidance, we pass the catheter tip over a wire into the blood vessels leading to the uterus. Your uterus has 2 sides, a left side and a right side. During the first half of the procedure, we usually guide the catheter into the blood vessels leading to the left side of your uterus. Using X-ray guidance, the catheter tip is then placed in the blood vessel directly feeding the uterus, called the uterine artery. An even thinner catheter called a microcatheter is then passed through the first catheter so we can go deep into the uterine artery. We inject more contrast dye and take X-ray images to clearly show the uterine fibroids. Here, you can clearly see the submucosal fibroid we saw earlier on the MRI scan. These are the particles we inject during UFI. As you can see, they are very tiny. We then inject millions of these tiny particles, each smaller than a grain of sand, into the uterine artery. Since the fibroids have a rich supply of blood, most of the particles go to the fibroids instead of going to the normal uterus. After completing particle injection, we inject more contrast dye to make sure blood flow to the fibroids has been stopped. Here, you can see the difference in blood flow to the fibroids before and after UFI. As we mentioned before, most women have 2 uterine arteries feeding their fibroids. This is an injection into the right uterine artery before UFI. And this is an injection into the right uterine artery after UFI. Again, the blood flow to the fibroids has been significantly reduced. At the end of the procedure, pressure will be applied to your groin to prevent bleeding from the tiny catheter hole. After 10 to 15 minutes of holding pressure, a small bandage will be placed over the skin nick. You will have to lay flat for 2 to 6 hours to give the catheter hole time to completely close. You will also be given medications to keep you comfortable and pain-free. Most women will stay in the hospital overnight for observation, pain control, and anti-nausea medication. However, if you do not need IV medications for pain or nausea, and if you are walking, eating, drinking, and using the bathroom without difficulty, you may be able to go home the same day of the procedure. Before you go home, you will be given very detailed instructions describing what to expect and when to contact your interventional radiologist. You will be able to return to full activity in less than 1 week. You will visit your interventional radiologist 1 week, 6 weeks, and 6 months after the procedure. An MRI scan of the uterus will be performed at the 6-week and 6-month appointments to see how much the fibroids have decreased in size and how much their blood flow has decreased. Here is the MRI scan of our patient 2 months after UFI. There was a significant decrease in blood flow and size of the submucosal fibroid that was responsible for our patient's heavy bleeding. Her other fibroids also had reduced blood flow. She recovered fully from the UFI procedure within 1 week. There were no complications. She had significant reduction in bleeding during her periods and is no longer soiling her undergarments. Her menstrual cramping has also improved to the point where she doesn't need any pain medication. She is very happy with the results of the procedure. I hope you found this case presentation informative. If you have any questions or would like to speak with a Gunderson interventional radiologist about uterine fibroid embolization, please contact us at 608-775-2770 or 1-800-362-9567, extension 52770. You can also visit us on the web at gundersonhealth.org/imaging/interventional-radiology.